For millions of couples, starting a family isn't always easy due to infertility issues. Many have to undergo the in vitro fertilization process. Add that to a pandemic, and that makes the usual 20 to 35% success rate even harder to reach. We'll meet one couple whose journey started on a rough note, but now they are ready to tackle this new challenge in a whole new world thanks to the Advanced Reproductive Endocrinology and Fertility Clinic here at the University of Kansas Health System. We're going to talk all about them, meet them, and their baby coming up on the Morning Medical Update. And good morning to all of you. We're so glad you're with us. It's Thursday, April 21st. Thank you so much for joining us on Facebook, YouTube, and on Twitter. Coming up at 8:25, more than 50% of people worldwide suffer headaches and migraines on a daily basis. The new treatments being tested to ease the pain in the brain. At 8:15, Dr. Dana Hawkinson joins us with the latest in COVID news and our COVID count. But first, turning heartache into triumph. A couple suffers a devastating setback, only to then have COVID slow their plans down yet again. They share their story and hope for other couples trying to build their family. Get your questions sent into us on YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. In vitro fertilization, IVF, as it's commonly referred to, has helped to bring more than 1 million babies into the world since it began back in 1978. In fact, the so-called first test tube baby, born in Britain, Louise Brown, turns 44 this year. And get this, the cost of each single IVF cycle could cost you anywhere from $10,000 to $15,000, depending on what your health insurance will cover. For one couple, their family plans didn't exactly go as planned. But instead of giving up when tragedy hit, they decided to try again in the middle of a pandemic.
We had been trying for some time.
Aaron and Josh Wersinski had already struggled with fertility. The day their first child was born was bittersweet.
It was the best day of my life because I got to experience giving birth and seeing this tiny little beautiful little baby that my husband Josh and I created.
But that happiness was short-lived.
But then the worst day of my life because I quickly realized that it wasn't going to be the family that we so badly have been wanting.
At 22 weeks, Aaron gave birth to a stillborn baby girl, Cora. Back on the fertility trail, Aaron and Josh's journey led them to the Advanced Reproductive Medicine Clinic at the University of Kansas Health System. And Aaron wants others to know,
although we live in this huge universe that we sometimes feel like we're the only one, if I can give somebody a little glimpse of hope that you'll get there and it'll be okay, then we've got to do that.
And we are so glad to be joined by Dr. Courtney Marsh here in studio with us. She's one of our infertility specialists here at the health system. And also we've got Josh, and we've got Aaron, and we've got baby Declan with us this morning. How are you all doing?
Good morning. We're doing wonderful. Thanks for having us.
So what is it like to be parents of this young man?
I mean, it's been the best 9 months we've ever had. It was the whole dream's been worth it. This guy is just absolutely amazing.
Well, he's doing such a good. What's that?
As you can tell, he's gotten to the phase where he's ready to be on the move and doesn't love sitting still.
Yeah, he is. The arched back. We've all been there with the little babies, but he's making his TV debut, I'm assuming, so he's a little excited, and we're glad he's with us. So I want to ask you both. You went through IVF during a pandemic. Part of that process was during this pandemic. Some of your process was put on hold. Tell us a little bit about what that experience was like for you.
Yeah, so during that process of IVF, it's a time game. In your mind, you always have what a timeline is going to look like for creating a family. And when you run into barriers that in relation to fertility, that time game kind of isn't on your time clock anymore. So when COVID-19 came in the pandemic, that stopped even more. And so that time became even more precious.
Is Declan done with us? He's over it. That's okay. I'm glad he was able to join us. I want to bring in Dr. Marsh, who helped treat you at the fertility clinic here. So how did COVID impact your practice? There were some pros and some cons.
Absolutely. So at the University of Kansas Health System, we did have excellent communication and leadership on what was going on in the pandemic. So we were able to prepare, and no one was actually stopped in the middle of their IVF treatment, which was great. We were able to get everyone to have eggs or embryos frozen. So that was great. But a lot of people, when we did have to put a pause to focus all resources to COVID-19, did have to delay their fertility treatment, which was devastating for a lot of couples. A positive we did see, though, was that telehealth had increased access, and we were able to reach couples from all different areas. So that was really a pro.
Dr. Marsh, I was really surprised to hear you say that there was quite a baby boom during this time. You really felt like people were kind of reprioritizing what was important in their life, and maybe starting a family was the right time, right?
Absolutely. We've experienced growth with the pandemic, which was a little surprising to me, but I think there has been a reprioritization for couples of what's really important, and building a family seems to be a priority for many couples.
Erin, let's bring you back in. Erin and Josh, both of you, just help us understand a little bit of just what's it like in the day of the life of someone experiencing infertility. How does that feel?
There are just so many different emotions that go into that. First, you have to wrap your head around and accept that things aren't going to go out exactly how you planned. And you have to trust in people to assist you to help get you to your dream and your end goal. We were very fortunate to work with the University of Kansas, and there's such a wonderful team from day one. Josh and I remember walking out of there in such a scary process, but looking at one another and saying, we think this is going to work from the very beginning. So there's that piece to it, but then there's the time commitment of it becomes a full-time job of management of medications, weekly appointments, and really working together with your significant other to navigate this new journey.
Erin, you and I kind of bonded when we did this story, a year and a half ago, because I too went through fertility treatments. Both of my children are IVF babies themselves, and it's hard when you watch other people have children so naturally. And then when you have to intertwine time and finances into the goal of trying to build your family, it gets kind of sticky. It's such a strange time. And Dr. Marsh, let's talk a little bit about that. We don't want cost to be, you never think when you're planning your family that cost is going to be an issue in doing that. So how do you work with families through that process?
Absolutely. Cost is definitely an issue. This is a part of healthcare that is a little bit, I think, lagging behind in terms of coverage. And National Infertility Awareness Week is coming up, and on resolve.org there are letters that you can write to your employers to help to get insurance coverage. Insurance coverage is expanding, and testing is often covered, but the treatments typically are not, which can be very frustrating.
It's a big deterrent. So why do you think people are turning to IVF more and more?
Well, IVF is a very successful option for conceiving. So it is our highest success rate typically to offer couples. And it's becoming less taboo. I think people are talking about this, and through programs like this, we're raising awareness that it is a viable option to build families.
Erin and Josh, I want to talk about Miss Cora, if we can, for a moment. You experienced a heartbreak really like no other with your daughter. Could you please tell us a little bit about her and how you found hope through that experience?
Yeah, so we began trying to create our family, and about a year into that process, with the assistance of some fertility medications, we finally got pregnant. And pregnancy was wonderful, felt great. We were just absolutely thrilled. And around 20 weeks, everything kind of came to a halt. At our 20-week scan, we realized that Cora was measuring small and didn't really know what that meant, so got sent for some additional testing and realized that Cora had trisomy 13 and a significant heart defect. Fast forward a few weeks later, around 23 weeks, I delivered Cora, and Josh and I got to spend a few hours with her and with our family, and really I think that pushed us to, that gave us that glimpse of what was this going to be like? What did being a parent now feel like? And pushed us even more that we've got to reach our goals of creating our family that we've always wanted.
And I know Cora continues to be a big part of your life, and she's Declan's big sister, I think is how you refer to her. So, Dr. Marsh, how do you help support families through this emotional time, especially when they're coming off of something like what Josh and Erin went through? And again, trying to find that hope and move forward.
Well, you're absolutely right. This can be such an emotional process, and studies have shown that they equate it to a cancer diagnosis. I mean, this is one of the most trying things that a couple can go through. So we do have psychologists that specialize in support for couples undergoing fertility. There are virtual support groups, again, through resolve.org, and we have counselors that can assist because it can be a very difficult journey.
Let's talk about the stigma of IVF. Like I mentioned, my kids, I call them kind of miracles of God and science. But there could be a stigma of having issues starting a family. And Erin, Josh, talk to us a little bit about that. What did you have to overcome stigmas or have those conversations with people? I'm sure you got a lot of questions.
Absolutely. Josh and I talked a lot about there's a lot of unintentional things that are said that can be incredibly hurtful for people that are going through this process. Well, when are you going to have a baby? Why haven't you had a baby yet? And then as people start to realize, oh, maybe this couple is struggling, comments like, it'll happen when you least expect it. Just stop stressing and it will happen. And so as somebody that's going through that, you've got to realize that those things aren't intended to be hurtful, even though they sometimes can. And you sometimes do feel so alone. And I think one of the biggest things that I realized is you're not alone. There are the statistics of families that are working through fertility issues is significant. And when you are able to find those support groups and people that have been through similar journeys, it really helps you throughout the process.
Josh, talk to us from the male perspective. I think we often hear from women going through infertility issues, but it affects you just as much. So tell us what this experience has been like for you, how you two have supported each other.
Yeah, for me specifically, it was very hard. Being a husband, I want to be with my wife, support her everything, especially this journey. Not being able to do that, not being able to go to the meetings or the doctor's appointments, having to several times sitting in my car for hours, video chatting is the only way I could find anything out. So it was very hard, but it also, it's hard to really put in words about how you feel because all you want is that family. And when you feel like you don't have control in your entire life, you've always wanted to have control over everything. It's hard, and it's extremely hard.
We have a community question from Tiffany in St. Joe that I want to ask. Is there an age limit, Dr. Marsh, for IVF? Can you be too young? Can you be too old to receive this type of treatment?
That's a great question. So in terms of a lower age, we do require someone to be 18 to be an adult to go through the IVF process. There are some exceptions to that rule for fertility preservation. But in terms of age limits on the upper end, success rates do go down in your 40s. So after the age of 42, success rates do start to drop.
But is there a time, so you wouldn't allow it, but is there, the younger, does that matter? Even if you're in your mid-20s? I know people that are close to 40, Dr. Marsh, and people who are in their mid-20s. Are success rates just better because your body's younger?
Correct. So the eggs do age. You are born with the eggs that you have. It's very different than sperm. So sperm is recreated and regenerated on a daily basis. You have a new sperm cycle every 3 months. But eggs are there. You have your highest number of eggs when you're in your mom's womb. So it's a little bit different game for women. Yeah, the success rates do drop in your mid-40s. We don't have hard age cutoffs, but we do want the highest success rates for our couples.
So does that mean that is that a myth or a fact that it's more incumbent on the female's body? Since you said since eggs are aging constantly and sperm turns over.
Yes.
What does that mean?
Yes, that is a fact that the number one determinant of success rates with fertility is the age of the eggs. So that is a fact.
All All right, Dr. Hawkinson is in the house with us today. Let's check in with him. He is our Medical Director of Infection Prevention and Control. He's joining us with some COVID news today and our numbers. Good morning to you.
Yeah, hi.
Hi.
Yeah, I don't think this conversation is as engaging as what we were just hearing from our guests. So, but I'll try. We have right now 6 active infections in the hospital, with 2 in the ICU, 0 on the ventilator. Still 16 in that recovery period as well. So numbers for active infections, people actually being treated for COVID-19, are continuing to stay in that single digits. Hopefully they will continue to do that. Although we have noticed cases rise, we've talked about that for the first time today on the national outlook on the Washington Post website. I did see that the hospitalizations have increased a little bit. We know probably a lot of that is driven by the Northeast numbers. So we're going to hold steady and continue to hope that we have enough population immunity and individual immunity, with everybody being up to date on their vaccination, that we can really continue to keep those hospitalization numbers down. So we'll see what happens the next 7 to 10 to 12 days as far as that goes. But hopefully overall we can keep people out of the hospital. And then now, again, we've mentioned this before, if you have symptoms, get tested early, get treatment early. We know that there is a good supply of Paxlovid and Molnupiravir out there, also with the monoclonal antibodies, so that is the best thing to do, especially if you're high risk.
Couple quick things I want to ask you about. Omicron was more severe for unvaccinated children, 5 to 11. That was a study that was out. What can you add to that?
Yeah, that was I think that was the MMWR article published by the CDC this week, and what that continued to show is that those children that are unvaccinated, and this is why it's so important that if your children are of the age to be vaccinated, please get them vaccinated. They had a significantly higher chance of going to the hospital, having severe COVID, and also those children with comorbidities as well, so obesity, diabetes, things like that. Also, that continues to be a risk factor as well. I think it just goes back to saying that those people that are vaccinated, and now, again, with children, we're not looking at the booster doses, 5 to 11, so just get them those vaccinations, get their vaccine doses, keep them protected, not only from hospitalization, severe disease, but also likely to have protection against long COVID as well.
All right, I have an update for you. I told you that Dominic had to get a COVID test yesterday. He was not happy with me, but I knew I had to do it. But anyway, he is negative, so he did go back to school today, and but it's kind of tough to know what to do, you know? So we did the home test. It came back negative, but I needed that PCR to make sure.
You know, and we're still waiting for the children 5 and below, certainly, to get vaccinated. Hopefully that will come within the next couple months. We know that they are looking and assessing all of that data, but I think that also goes, now if you have problems with Dominic in the future and he's being a bad boy, just tell him he's going to have to go get a COVID test. I think that might work for all the parents out there.
Well, I feel bad. I told him that, I said, we did the home test, and of course that's much gentler. And then we went to Dr. Lauer's office, and he was screaming. So we had to go, we loaded up on McDonald's afterwards. I hate to admit it. Yes, I owed him big time. He was not happy with me.
Yeah.
Okay. So another thing I wanted to ask you about is Justice Department to appeal decision lifting mask mandates on planes, trains, if the CDC deems that rule necessary. Thoughts on that?
Well, I think they have deemed it necessary. We know that this ruling by this judge was a legal ruling, and based on legal and semantics. It was not based on public health guidance nor medical guidance. We know that masks continue to work. We know that restrictions overall have come down. We know that the virus continues to circulate. What we've also seen is that the cases overall are going up. And so I think it is important to continue to mask in those high-risk situations. If you are high risk as well, again, the best thing is to be vaccinated and up to date, but you can always decline to go into some of those high-risk situations. Now, if you're traveling, that is one thing you really can't avoid, because you are going to be around a lot of people, whether that's in the airport, the bus station, the train station, whatever that may be. If you are in a city that has subways and on mass transit, it's extremely important. Continue to wear your mask. We know that masking with vaccination overall is the best thing to help prevent illness and especially hospitalization and severe illness.
All right, we'll check back with you here in a few moments. Next week is National Infertility Week, though. We are back with Dr. Courtney Marsh here in studio, who may be able to do a little myth busting for us to answer some of these questions. So I want to ask you this, doctor. So fact or myth, I cannot afford to see a reproductive specialist and heard if they recommend IVF. So talk to us a little bit about if you've been recommended to, that's how I was. Somebody told me to go there. First, what, ding, ding, ding. I can't afford that. Help us through the finances of it.
Yeah, absolutely. I feel that that's a common myth, that all we do is IVF, and it actually is less than 3% of the services we offer. So IVF is highly talked about, and it's a very successful option for some couples, but we help a lot of couples conceive without IVF. So that is a myth. The other thing is that the testing is typically covered by insurance companies. So it is a myth that you can see us and it's all going to be out of pocket. The treatment is another situation, but testing is typically covered.
So IVF, expensive. It can be if insurance doesn't cover it. But you're saying there are other options before you get to like IUI. Talk to people about that there are other routes to go before you have to go the IVF route.
Correct. For a lot of couples, IVF is not needed. So we help people conceive with medications to boost their ovulation, helping with what you just talked about, IUI, which is an intrauterine insemination where we wash the sperm and put the sperm into the uterus. So we do have a lot of other options that we can explore with couples to help them conceive.
All right, you did talk about this a little bit before, the male-female factor, but fact or myth, I don't need to get a sperm analysis because I've already had children.
Yes, I hear this a lot. I have, children, and so I definitely have sperm, and that may be true. And the effect of age on sperm is less than the effect of age on eggs. But this is a myth that you don't need to get a semen analysis because things can change for sperm health as well. And people often forget about the sperm. So it does take egg and a sperm to be able to conceive, and we don't like to forget about the sperm.
This fact or myth has been a big question throughout the entire pandemic. COVID-19 vaccination can change your periods and hurt your fertility.
Yes, absolutely. So there was a great study that came out on this, and it is true that with your cycle in terms of getting the vaccine, that cycle can be delayed, and you can have a long cycle. So you can have menstrual disturbances with that first cycle within your vaccine. But after that, cycles went back to normal. So fertility is not disrupted on the male or female side with vaccination. So that's a pro.
Josh and Aaron, what questions did you have before you went down this road? I'm sure you had many.
We did. We had, just from the whole process of the financial piece, what are the steps that we take. We, as Dr. Marsh talked about, we started with not IVF from the beginning. We went through and then ended up doing IVF due to not having success on the other routes. So we had questions about how long would it take, the cost of it, all the different medications, how do we inject those and when do we take them? So every little thing you can think of, we had a question.
Looking back now, though, what was your biggest challenge? What, emotionally or physically?
I think our biggest challenge was definitely emotionally. Physically, yes, there are things that your body experiences during that time, but emotionally, just that unknown. Is this going to work? And, after experiencing what we did with Cora, it was even more scary of, are we going to have what happened then happen again? So I think that emotional piece was the most difficult, and remaining strong partners with one another and supporting one another, but also relying on our support system. That was our medical team, that was our family, that was our friends, and understanding that we had a strong support system to help us through this.
That's a big factor, the support, right, Dr. Marsh?
Absolutely.
All right, let's see if there's any reporter questions on the line before we get going. All right, we've got some community questions coming in. Emily wants to know, what does a telehealth visit include for a fertility consultation? Are you doing fertility consultations via telehealth, Dr. Marsh?
Absolutely. That's been a very positive thing. And I was just thinking about all the places I have done Zoom visits with patients on the
tell us.
Yes, you name it. So one of the more interesting ones was on a cruise. They were in a Mediterranean doing a cruise and were able to Zoom with me and talk. I had someone who was in shutdown in Italy in their apartment, and they were able to do a telehealth visit, someone from Australia. So really it became an international affair, and it really broadened our touch of being able to help couples. And so for people traveling, we have a lot of couples that travel maybe 6 hours to come see us. If you're not doing testing that needs to be in person, it is a nice option to be able to still talk face to face. It doesn't replicate the in-flesh experience, but to talk face to face and be able to have visits.
Jenny wants to know, if I'm going through fertility, does acupuncture help?
Yeah, studies are mixed on acupuncture, and I think this varies on how the acupuncture is done. So some studies will show that there is a benefit with IVF and success rates, especially with acupuncture around the embryo transfer. And then some studies will show that there is no benefit. We do not see that it's a harmful process to go through, and so if it's something that is desired by a patient or a couple, we do encourage some consultation with acupuncturists.
Erin and Josh, a question for you is, what is your response to those who have turned down the COVID vaccine because they are concerned about it affecting their infertility?
I think my biggest response to that is talk to your medical team and get the input from the medical professionals who have the most information and make that decision together. We decided very early on that that was important to us, that we wanted to protect ourselves as much as we could. I actually got vaccinated while I was pregnant and got my booster right after Declan was born. And that was a choice that we felt was important.
All sorts of right answers in that response, Erin. We're very proud of you. And you're giving the advice to go to the medical professionals and get the right information. What kind of questions are you getting, Dr. Marsh, and how are you having that conversation with your patients?
Yeah, lots of questions about the safety of the vaccine. And, from the beginning, it was a little bit hard for us to answer some of the questions. I mean, we did have some data from the Johnson & Johnson vaccine with some empiric pregnant data, but pregnant patients were not included in the initial trial. So it was a little bit of talking about the unknown, which was scary. But now we know, and we have a lot more data, that the vaccines are very safe and they do prevent severe illness and ICU stays. And, like you were just talking about, Erin, by giving that booster right in that postpartum period, you were able to provide some immunity to your baby through breastfeeding if you breastfed. So there's some really positive things with vaccination, and so we're very pro-vaccine.
All right, Ashley has a question, Dr. Hawkinson. Can we discuss the logistics of what it would take for doctors to stop recommending masking on a day-to-day basis, like before the pandemic?
I think there's, number one, going to be a selection bias there for physicians and healthcare personnel in general. There are so many ways and graduations of this answer. Certainly I think the first thing to do is take in your risk. And I think certainly if you are the younger population, you probably have less risk of hospitalization and severe disease. If you're in that older population, then you're going to be at higher risk. And so what is it going to take for physicians to stop recommending that? I think it goes to that individual patient, and that also kind of some of that information from that individual physician as well. Again, I think for some people, if you are wanting to get out and to be in doing things like pre-pandemic without the mask, and as long as you're vaccinated and up to date, that can be okay. But there is still that risk for those other populations as well. So I think that answer to that question is complex, and I think it deals with, number one, that individual patient, especially their vaccination status, and then that physician as well. So I'm not sure across the board when physicians are going to agree, yes, we can all take our masks off. And I think also you're talking about, are you in specific situations like the hospital and patient care areas, or is it just out in public? So I think overall that's a difficult question to answer, but I think those are going to be the two most important things. What is your individual risk, and then also the opinions of that physician. Overall, the goal is to continue to protect your health and make sure that you are going to have the highest chance possible if you get COVID-19 to stay out of the hospital and the ICU.
Aaron and Josh, I have a comment from one of our viewers. Aaron, I know you've been doing a lot of the talking this morning, but silence says a lot sometimes. Ashley says, find you someone who looks at you like this man looks at the mother of his children. So, what's that?
I said I'm pretty lucky.
You are pretty lucky. I love that. Question for you, another one for you, Dr. Hawkinson. Joellen wants to know, would you please summarize what's going on with boosters being developed to address changes in COVID?
So right now we know that there are pivoted vaccines, particularly mRNA vaccines, looking at different spike proteins. I think Moderna is doing a test with a beta variant spike protein. I think they've also done some Omicron tests. They are looking at a bivalent vaccine, which means 2. So they are looking at I think it was a beta spike in the vaccine with a original Wuhan strain or WA1 spike as well. Will these ever come to market? It's very difficult to say because we know that as soon as we've identified a variant, they do have that surge and they seem to kind of fizzle out as well. So by the time you were able to bring one to market, is it going to be reliable? There is that question going on, and just heard an interview with Dr. Borla, who works with Pfizer, who's the CEO of Pfizer, and they are working on that as well. And so I think they are working on these pivoted spike vaccines, these mRNA vaccines. But I think what we have to remember is that the current vaccines that we have, if you are up to date, continue to provide excellent protection across the span of all the variants. Why is that? Probably because of those T cell epitopes. It's not the antibodies, but it's the T cells which help protect you against severe disease. Those epitopes or those areas on the spike really are fairly constant and don't really change that much. So we have been fortunate enough to have the fact that we do have these current mRNA vaccines that when you are up to date with them, they continue to protect you very well against hospitalization, severe disease, and death. But overall, we know that the vaccine companies are working in some form on having different or pivoted vaccinations.
We have new information on migraines coming up here in just a moment, but I want to get final thoughts from our guest today. Dr. Marsh, I'll start with you.
Perfect. Well, as you said, it is National Infertility Awareness Week coming up, and the first thing I would like to share is that we are not scary people. So please come see us. If you are concerned about your fertility, if you're struggling to conceive, come see us. Second thing would be if finance is an issue and you are struggling to pay for fertility treatments, please write a letter to your employer. There are templates on the resolve.org, and continue to fight like us to support patients in getting coverage for fertility services.
Thanks for all you do for helping us build our families and expand. Dr. Marsh, thanks for being with us today. Also, thanks for being with us, Declan, Aaron, and Josh. So glad to see you all doing so well. Final thoughts and maybe your advice to couples going through what you went through.
I would say, although it does feel stressful and you feel all alone during this process, you're not alone. There are plenty of support groups out there. Find one. I know my wife loves to journal it. We talk about all these things. Communication's key in these situations. And work with the University of Kansas. They were absolutely fantastic. I couldn't have been happier with what we got from them.
Josh, thank you. Aaron, your final thoughts.
I would just echo what Josh said. Make sure that you have a strong support team. Get with the medical team that you trust, and that in the end, it might be difficult. It might not take every step that you expect it to, but hopefully in the end, you'll get to the outcome that you want.
Thank you both so much. Take care, Declan. Josh, keep gazing at your wife the way you do. It's much appreciated. She deserves it. And we'll stay in touch. Okay, Aaron?
All right. Thanks so much.
Thank you so much. Dr. Hawkinson, final thoughts?
Yeah, I think there were such great questions today on vaccination and masking. We know that there are still vaccination experiments going on, looking at pivoted vaccines, like I said, looking at the best way to protect us. Will that be with different vaccination? What is that schedule going to be? Is it a yearly thing? Is it less? Those are all questions that are being looked at. Hopefully we'll have answers to some of those soon. The other question about masking, again, I think what we've seen from this, again, legal semantic argument and getting away from that mask mandate rather than a public health or medical ruling is that there are no mask mandates currently, especially for travel. And so it is up to you as an individual to really understand your own risk. And the best way to protect yourself from coming to the hospital is to continue to be up to date with your vaccination. Wear those masks in those places where you may feel uncomfortable. Maybe you have to avoid some of those situations, but it's really now understanding your risk and what you feel comfortable with and judging that. So as we move forward, we'll see. We know that the Department of Justice will be appealing that ruling. But until then, just please understand your risk. You are always welcome to wear a mask, and that will help reduce infection and disease as well.
Thank you so much. Yeah. Dr. Dietrich Ford, neurologist here with the Health System, is joining us now. Well, if you suffer migraines or chronic headaches, you know it is the worst, but do they run in the family? Are all family migraine sufferers created equal? That's why we have you on this morning to kind of help us figure this all out. So, Doctor, good morning to you. Do you see migraines running in families? And if so, do they present in the same way or can they be different?
Sure. So we definitely see migraines running in families. It's interesting how it can change though. Some will start early in childhood, some will start later in the 20s, and some even later in the 60s. People can have migraine with or without aura, and the auras don't always have to run together in the family. There are some specific types of migraine with hemiplegia, so that's a very specific and different type that has potentially some underlying other genetic abnormalities associated with that, and those definitely run in families. So we see different ages, we see different presentations, but typically if someone has migraine, there's somebody else in that family that's had it as well.
So does the medication used for one family member work for the others? Treatment must be different for everyone.
Yeah, that's always a really interesting conversation in clinics. That people will tell you that this medicine worked really well for this family member and I really want to try it. I'm never against trying it as long as it's a safe medication for that patient. But I will say that people respond very differently to medications, and that goes across for most things in life. But we have yet to come to a point where we're doing genetic testing to see what medications respond best to which patient with any consistency. So currently it's truly trial and error on what we call kind of the older platform medications.
So what does the landscape of migraine treatment look like currently and perhaps in the future through some trials that are going on right now?
Absolutely. So currently we have more options than we've ever had in the past. In the past, we only had other medications that by default worked for migraine. Currently, we have some FDA-approved migraine medications that are specific, which is really nice. So we're looking at things like Botox and monoclonal antibodies, which is pretty new for us. So the newest method is CGRP. They are looking at that receptor and that peptide and trying to see if blocking that helps, and we found it has. And so that's a pretty specific thing that we don't need to get into too much detail about, but that's really where the landscape is moving toward. There are a lot of drugs in the pipeline currently that will be targeted more to that marker. And the other things that they are looking at are other serotonergic receptors that maybe don't have as much risk for serotonin syndrome or cause as much vasoconstriction, which is what we worry about, the blood vessels getting too tight or too small, which is what some of our current medicines can do. So a lot of patients are left without a choice because they have underlying cardiac disease or have had a stroke or TIA in the past, and we are unable to use those meds. So really, we're moving into a new era where we're allowing more treatment options for more patients. We're able to reach more people.
All right, here's a treatment option. I have a question for you from one of our community members. Isaac says, Dr. Ford, I've heard that ice cream can help mitigate migraines. Is this true? It sounds like a good option to me.
That's great. So everyone has different things that work for them. Some people, ice cream makes it worse. Some people, it makes it better. There was a little fun, I don't know that I would call it a real study, but a fun just kind of case series that they looked at with that. And some people did get better with ice cream, but it's very different for each person. I highly recommend that if you have migraine, you talk to your physician, because there are so many options available to decrease the disability and suffering from those.
Okay, that might be a very temporary thing that makes you feel good, but we will come see you if we are not feeling well. Dr. Dietrich Ford, thank you so much for sticking around with us today. Always good to see you.
Thank you.
Thank you. Well, before we wrap up here today, host of All Things Hard, Alexis Del Cid, joins us from Studio B with a preview of what you can expect coming up at 10 a.m. Good morning, friend. How are you?
Good morning, Jess. We have such a good show today. Coming up on All Things Hard, you're going to meet a man whose smartwatch played a major role in how doctors treated a life-threatening heart condition.
One thing is clear from the moment we step into Jeff and Jill Barnhouse's Overland Park home. This is a house filled with action and love.
Sweet. Oh, okay. Sorry.
So if we want to talk to Jeff and his wife about the scary event,
oh my God, I was so scared.
and the thing on Jeff's wrist that helped doctors decide they needed to quickly perform a life-saving heart procedure, we need to somehow coax two of the cutest toddlers you'll ever see into briefly sharing their daddy with us.
2021. Okay. Okay.
It was a typical Saturday a year ago when Jeff says he hopped on their new Peloton bike just to get a feel for the pedals. A few minutes later, he remembers asking Jill for water. Jill says she left the room for 20 seconds, came back, and Jeff was on the ground. He'd passed out and fallen off the bike.
He had the look in his eyes that I don't ever want to see again. Like they were open, but he was not there.
The next thing Jeff remembers is his eyes focusing and seeing the worried little face of his sweet son.
Said the first thing I saw when I came to was Ben.
What was he doing?
He was just standing there, kind of looking down at me. But yeah, it was scary. But Dr. Sheldon really put a plan in place that helped a lot. Yeah, it was. I'm just very thankful.
Jeff was rushed to the ER. He didn't know it at the time, but the doctors there would make some crucial decisions based on the treasure trove of information contained in Jeff's smartwatch. It would directly impact the course of action they took, including making Jeff a priority patient and performing a cardiac ablation on him shortly afterwards.
Daddy.
A life-saving device, a life-changing event, reinforcing for Jeff that the only things that really matter in this whole world are right here in this house with him.
So coming up at 10 a.m., you're going to meet the cardiologist who helped save Jeff's life. He will join us live along with Jeff, and they're both going to share what it was that was on Jeff's watch that helped doctors act so quickly and inspired them to take the moves they made. He'll also share, the doctor will, the features that we all need to look for when we're choosing fitness trackers. And you'll get to see video of a heart procedure just like the one performed on Jeff and hear from Jeff about what life is like for him today. That's all coming up on All Things Heart at 10 a.m.
Alexis, can't wait to see that. Can't wait to meet Jeff and his doctors. Thank you so much. Well, making her wish come true, we want to introduce you to 8-year-old Elena. The Kansas City girl is a leukemia survivor. When the Make-A-Wish Foundation asked her what she wanted, she said simply, to help others. Yesterday, she dropped off a variety of items to 15 Metro charities, including Harvesters and our partners over at Children's Mercy Hospital. She also gave doctors at Children's a $500 check to help in cancer research. So, Kansas City Mayor Quentin Lucas proclaimed yesterday as Elena's Wish Day, as he should. Mother's Day is just about a month away. We want your ideas still, so send them in. Use that QR code right there on your screen to tell us what you want to give, what you want to get. We'll share those ideas. You could also email us here at the Medical News Network at kumc.edu. All right, thank you so much for being with us today. Don't forget, you can catch our shows anytime by logging on to Facebook, YouTube, and on Twitter. Everyone, have a great Thursday. Coming up tomorrow on the Morning Medical Update, journalists covering the pandemic had more than the virus to overcome. How do they keep staff safe and cut through the information? Join us Friday to learn more about what happened behind the scenes to cover a once-in-a-lifetime pandemic. See you at 8 on the Coming up tomorrow on the Morning Medical Update. Journalists covering the pandemic had more than the virus to overcome. How do they keep staff safe and cut through the information? Join us Friday to learn more about what happened behind the scenes to cover a once-in-a-lifetime pandemic. See you at 8 on these social media channels.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.